Look in the mirror right now, stick out your tongue, and take a real look at it, because what you see could be telling you something about your health that you have never once thought to check. Most people only think about their tongue when something tastes off or when a dentist briefly glances at it during a routine cleaning. But your tongue is actually one of the most revealing parts of your entire body, packed with blood vessels, nerve endings, and tissue that responds quickly to changes happening inside you, often long before you feel any other symptom at all. Today, I am walking you through 7 specific things your tongue can reveal about your health after 60, and by the end of this video, you will know exactly what to look for the next time you brush your teeth. Let me start with someone I will call Dorothy, a 67-year-old retired librarian living outside Sacramento, California. Dorothy felt completely fine, no major complaints, just the usual tiredness she assumed came with getting older. One morning, brushing her teeth, she noticed her tongue looked unusually pale, almost a light pink rather than its normal healthy red color. She nearly brushed past it, assuming it was nothing, but something made her mention it at her next checkup. That single offhand comment led her doctor to run a simple blood test, and the results showed she had developed iron deficiency anemia, something that had been quietly building for months without any other symptom obvious enough to catch her attention. Dorothy's story is exactly why this video matters, because the tongue often shows changes before anything else in the body does. The first thing to look for is exactly what Dorothy noticed, an unusually pale tongue. A healthy tongue is normally a deep pink to red color, thanks to a rich supply of blood vessels just beneath its surface. When your tongue looks noticeably paler than usual, almost washed out, it can be a sign that your blood is not carrying enough oxygen-rich hemoglobin, which is often linked to iron deficiency or other forms of anemia. This becomes more common after 60 for a few reasons, including changes in how efficiently your body absorbs iron from food, certain medications that can affect absorption, and in some cases, slow internal bleeding that has not yet produced any other noticeable symptoms. A pale tongue paired with feeling unusually tired, short of breath during light activity, or feeling cold more often than usual is worth mentioning to your doctor, because a simple blood test can confirm or rule this out quickly. The second thing to look for is a tongue that appears unusually red and smooth, almost shiny, sometimes described as looking like a peeled strawberry. This particular appearance is strongly associated with deficiencies in vitamin B12 or folate, 2 nutrients that become harder for the body to absorb efficiently as we age, particularly for anyone taking certain long-term medications for acid reflux or diabetes, both of which can interfere with B12 absorption over time. When the tiny bumps on the surface of your tongue, called papillae, become smooth or disappear, the tongue takes on this glossy red appearance because the surface texture that normally makes it look slightly textured and duller is gone. Beyond the tongue itself, B12 deficiency can also contribute to numbness or tingling in the hands and feet, balance problems, and memory difficulties, which is exactly why catching this specific tongue sign early can sometimes explain symptoms that seemed completely unrelated at first. The third sign is a thick white or yellowish coating across the surface of the tongue. A very thin, light coating is actually normal, and most people have it to some degree, but a thick, persistent coating that does not go away with normal brushing can point to a few different things. Sometimes it simply reflects mild dehydration, since saliva naturally helps keep the tongue's surface clean, and dehydration reduces saliva production, allowing bacteria and dead cells to build up more than usual. In other cases, a persistent white coating, especially with a cottage cheese-like texture, can indicate an overgrowth of yeast in the mouth, something that becomes more common in people taking inhaled steroids for breathing conditions, people with diabetes that is not well controlled, or anyone whose immune system is working a bit harder than usual. A yellowish tinge to the coating, rather than pure white, has also been associated by some researchers with digestive sluggishness, though this connection is less precise and worth discussing with a doctor rather than assuming on your own. The fourth sign involves the edges of your tongue rather than its surface. If you notice scalloped or wavy indentations along the sides of your tongue, almost like the edge has been pressed against something repeatedly, this is often caused by your teeth pressing against the tongue, usually during sleep. While this might sound minor, it frequently points to one of 2 underlying issues. The first is nighttime teeth clenching or grinding, something many people are completely unaware they do until a dentist or partner points it out. The second, and more important one to rule out, is swelling of the tongue itself, which can be an early physical sign of an underactive thyroid, a condition that becomes significantly more common after 60 and often produces vague symptoms like fatigue, weight changes, and feeling cold that get dismissed as simply part of aging. If you notice these scalloped edges along with unexplained fatigue or weight changes, a simple thyroid blood test is a reasonable thing to ask your doctor about. The fifth sign is the appearance of deep cracks or fissures running across the surface of the tongue, sometimes called a fissured tongue. A few shallow lines here and there are extremely common and usually harmless, simply a natural variation that becomes slightly more pronounced with age. However, when these cracks become deep, numerous, or start trapping food debris that is difficult to clean out, it is worth paying closer attention. Deep fissuring has been associated with chronic dehydration, certain vitamin deficiencies, particularly B vitamins, and in some cases with conditions that affect saliva production, since adequate saliva helps keep the tongue's surface smooth and protected. If you notice your fissures have become noticeably deeper or more numerous over the past year or two, increasing your water intake and mentioning it at your next dental or medical checkup is a reasonable first step. The sixth sign to watch for is any patch of white, gray, or red coloring that does not match the rest of your tongue, particularly if it does not go away within 2 weeks. This is the one sign on this list that genuinely warrants prompt medical attention rather than simply monitoring at home. Persistent patches, especially ones that feel rough, thickened, or develop a sore that does not heal, can sometimes be an early sign of oral changes that a doctor or dentist needs to examine directly, particularly in people with a history of tobacco or alcohol use, though it can occur in people without those risk factors as well. The vast majority of unusual patches turn out to be harmless, often related to minor irritation from a sharp tooth edge or a hot food burn. But because early detection matters so much for anything more serious, any persistent patch lasting beyond 2 weeks deserves a direct look from a professional rather than a wait-and-see approach. The seventh and final sign is a burning or tingling sensation on the tongue that occurs without any visible change in its appearance at all, sometimes called burning mouth sensation. This can feel like you have eaten something too hot or spicy even when you have not, and it tends to be more noticeable later in the day. This particular symptom has been linked to several different causes in people over 60, including dry mouth from reduced saliva production, certain medications, nutritional deficiencies we already discussed like B12 and iron, and in some cases, changes related to menopause for women. Because the list of possible causes is fairly broad, this is one symptom where keeping a simple log of when it happens, how long it lasts, and what you ate or took that day can give your doctor much more useful information than simply describing the sensation in general terms. Now let me tell you about someone else, a 71-year-old man I will call Walter, living in a suburb outside Charlotte, North Carolina. Walter noticed a burning sensation on his tongue that came and went for nearly 2 months before mentioning it to anyone. He assumed it was related to a new toothpaste he had started using, and he simply switched brands a few times without much improvement. When he finally brought it up during a routine appointment, his doctor asked about his medication list and discovered that a relatively recent change to his blood pressure prescription was a known, if uncommon, cause of exactly this kind of sensation. Adjusting his medication resolved the issue within a couple of weeks. Walter's case is a useful reminder that tongue symptoms are not always about vitamins or hydration. Sometimes they are simply your body's way of flagging a medication side effect that would otherwise go unnoticed. I want to spend a moment on why the tongue specifically tends to show these changes earlier and more clearly than other parts of the body. The tongue has one of the highest rates of cell turnover anywhere in your body, meaning its surface cells are replaced extremely quickly compared to skin elsewhere. This rapid turnover means that nutritional deficiencies, circulation changes, and certain medication effects tend to show up on the tongue's surface noticeably faster than they would show up as, say, a change in your skin or nails. In a sense, your tongue acts like an early warning display for things happening throughout your body, simply because its tissue responds and changes so quickly compared to almost anywhere else you could look. It is also worth mentioning that several of these signs can overlap or appear together, and that is actually useful information rather than something to feel anxious about. For example, someone dealing with long-term acid reflux medication use might notice both a pale tongue from reduced B12 absorption and a thicker coating from changes in saliva production at the same time. Rather than treating each sign as a completely separate mystery, mentioning the full combination to your doctor gives them a much clearer picture than describing just one symptom in isolation. This is part of why keeping a simple note on your phone, even just a sentence or two, whenever you notice something different about your tongue, can be genuinely useful information to bring to your next appointment, rather than relying on memory alone weeks or months later. I also want to address something that comes up often whenever this topic gets discussed, which is the question of how often you should actually be checking your own tongue. You do not need to turn this into a daily ritual filled with worry. A simple, brief glance once or twice a week, ideally in good lighting like a bathroom with a window, gives you enough familiarity with your own normal baseline that you will naturally notice if something changes. The goal here is not to create anxiety about every small variation. Tongues naturally have some texture and color variation from day to day depending on what you ate, how hydrated you are, and even how well you slept. The goal is simply to build enough familiarity with your own normal appearance that a real, lasting change stands out clearly rather than blending into normal day-to-day variation. There are also a few simple daily habits that support overall tongue health and can reduce several of the issues we have discussed today. Staying consistently hydrated throughout the day rather than drinking large amounts all at once helps maintain healthy saliva production, which protects against coating buildup, dryness, and burning sensations. Gently cleaning your tongue as part of your regular oral hygiene routine, either with a soft toothbrush or a dedicated tongue scraper, removes the bacteria and debris that can contribute to coating and odor issues. And paying attention to your overall diet, particularly ensuring adequate intake of iron and B vitamins through foods like lean meats, eggs, leafy greens, and fortified cereals, supports the nutrient levels that directly affect tongue appearance and health. Before we wrap up, here's a quick recap of the 7 signs we covered today, so you have a clear list to check the next time you look in the mirror. A pale tongue can point toward iron deficiency or anemia. A smooth, glossy red tongue can point toward vitamin B12 or folate deficiency. A thick white or yellow coating can reflect dehydration or a yeast overgrowth. Scalloped edges along the sides can indicate teeth grinding or tongue swelling linked to thyroid issues. Deep, numerous cracks can reflect chronic dehydration or vitamin deficiency. Any unusual patch lasting more than 2 weeks deserves a direct medical or dental evaluation. And a burning sensation without visible changes can be linked to dry mouth, medication side effects, or nutritional gaps. None of these 7 signs are meant to alarm you, and most of them have simple, manageable explanations once you bring them to your doctor's attention. The real value here is awareness, knowing what to actually look for, rather than overlooking your tongue completely the way most people do for their entire lives. Your tongue has been quietly working for you every single day, and a few seconds of attention each week could help you catch something important long before it becomes a bigger problem. If you found this helpful, share it with someone in your life who might benefit from taking a closer look the next time they brush their teeth. And if you want more simple, practical health checks made specifically for people over 60, hit subscribe because we put out new videos exactly like this one every single week. Take care of yourself, and I will see you in the next video.